So thank you for inviting me. I was asked to talk about practical applications of virtual reality, so I decided on this virtual reality and mental health, a self-counselling approach. And my talk will be in the following sections. First of all, I'm going to talk about the traditional approach to using virtual reality with exposure therapy. And I'll talk about a particular application on fear of heights. Then how discoveries in perceptual science can be applied to psychological counselling, body ownership illusion, and change blindness. And then I'll look at a number of applications. I may skip one of these depending on the time. And please, the chair, please interrupt me when you think that I should be beginning to stop. So I'm going to dive straight into an experimental study. This was led by Daniel Freeman from Oxford. And it's about automated therapy for fear of heights with a virtual therapist. And its paradigm is exposure therapy, which I'll explain in a minute. So 100 subjects were recruited for this, people with strong fear of heights. 49 were in a VR treatment group and 51 in a control group. And the control group just had their usual therapy. And exposure therapy means that people are gradually exposed to fear of heights, to their heights rather, but this time in virtual reality rather than having to do it with real heights. So they had a 30-minute sessions over 2 weeks, and there were 3 different fear of heights assessments, the most important being the heights interpretation questionnaire. They had this before. Well, it was used part of the recruitment. They had to score high on this questionnaire to be recruited. Then at the end of the treatment, then 2 weeks later. And what they did over these 6 sessions, they gradually ascended a series of levels of a building with feedback from a virtual therapist. The virtual therapist was pretty simple. It would just ask them questions like on a scale 1 to 7 or something, or do you want to go up to the next floor, assess their anxiety, and then choose the next step. So there, as I said, there's a sequence of behavioural tests, go up or down the level, depending on the person's current state. So the results showed a significant reduction in this HIQ measure, maintained over the 2 weeks after the last experience with a large effect size. And 49 people in the treatment group, actually by the end of the 6 sessions of treatment, fell below the trial's fear of heights entry criteria. In other words, if they were going to be tested again, they wouldn't even be included in the trial because their score was too low. And on the other hand, none of the people in